It's September 22nd, 2021 in London, Ontario, at the London Centre for Trauma Therapy. Today, Kevin is here attending an 8-week program for trauma recovery, and today he is meeting with Michaela, an occupational therapist.
Hi, I'm the societal context. In the societal context, Kevin and his future occupational therapists are situated within the broader context of society prior to entering the client-therapist relationship. Kevin's societal context includes his physical, social, cultural, and institutional environments. The physical environment is composed of both the natural and built environments, technology, physical accessibility, and changes in the physical nature of the world over time. In this case scenario, Kevin resides in a large city in southwestern Ontario where he normally lives with his immediate family. Currently, Kevin is in an 8-week inpatient PTSD program in a mental health facility. Kevin works as a police officer, and his primary environment for work prior to entering the program was his cop car, where he would drive around his hometown patrolling. While he worked as a military police officer, he was based mainly in the Middle East. The social environment consists of social networks, workplace support, community resources, and social events, and changes in dominant social ideologies over time. Kevin's social network consists of his wife, 2 children, and his work supervisor, who has been very supportive in regards to Kevin's mental health over the past few weeks. Kevin also regularly attends men's support groups within his PTSD program. Currently, Kevin does not have a counselor or psychologist that he regularly sees, as there isn't one in his hometown. The cultural environment includes, but is not limited to, ethnicity, race, gender, age, habits, workplace culture, and occupational expectations. Kevin is a 52-year-old male who has been a police officer for 21 years and worked as a military police officer for 8 years. That being said, cop culture is very prominent within Kevin's workplace. Within his high-stress professional role, Kevin is expected to prepare for the worst and is continuously at risk for violence, harassment, and racism. His experiences being submerged in cop culture and having served in the military could be detrimental to his mental health. Lastly, the institutional environment is made up of institutional structures, workplace policies, economic and political context, the healthcare system, and government funding. We can assume that Kevin's workplace has policies in effect that allow for employees to take disability leave for mental health purposes. We can also assume that Kevin's inpatient program is covered through government funding, as he is in a mental health facility and not at a private practice. Kevin is currently on short-term disability, which allows him to receive 100% of his regular pay. However, in a few weeks, Kevin's pay will drop to 75% as he will be placed on long-term disability. This places financial strain on Kevin and his family. Between his job as a police officer and his participation in community work, Kevin works about 60 to 70 hours per week, significantly more than the average full-time job, which could also have adverse effects on his mental health.
Kevin and Michaela now enter the practice context as the professional relationship begins.
Hi, I'm the practice context. This component of the CPPF is embedded within the broader societal context and brings together both personal and environmental factors. The personal component of the practice context includes demographic and health information, knowledge, skills, and abilities, as well as the unique perspectives, values, and beliefs held by both the practitioner and the client. Kevin's personal factors are as follows. He is a 52-year-old male with 29 years of experience as a police officer. Kevin has been diagnosed with post-traumatic stress disorder and has a history with depression and substance abuse. However, he has been substance-free for approximately 3 months. Kevin struggles with emotional regulation and reports feelings of numbness and expresses feelings of shame, worthlessness, and low self-esteem. During his childhood, Kevin experienced emotional, physical, and sexual abuse. He has fears of losing his sobriety once he returns to work, as his PTSD symptoms have worsened since becoming sober. Kevin has very few leisure activities and really values being a caretaker for others, but fails to take care of himself as well as he takes care for others. The second component of the practice context is environmental factors. Environmental factors describe the physical, social, cultural, and institutional aspects of a client's circumstance. Physical factors explain the structural components of a patient's home life, community, and organizations. For example, Kevin is currently involved in an 8-week PTSD inpatient program with a focus on community-based social rehabilitation, but normally lives at home with his wife. Social factors can be described as the social supports and factors that would influence a client's social experience. Kevin does seem to have a developed social support network involving his wife, his 2 adult children, his supervisor at work, and his support group. The cultural environment factors in the practice context explain the cultural dynamic of a client's life. In Kevin's situation, the culture of his inpatient clinic is very community-based and uses socialization as a treatment for patients. The last factor within the environmental aspect is the institution. Kevin's primary institutional barrier is the police department policy that requires Kevin to return to work as a support manager before returning to the field. Additionally, there are institutional factors coming from the inpatient clinic and his support group. These personal and environmental factors that are specific to the context of Kevin's case must be considered as we work through the CPPF, as they will help to describe both the occupational issues and the occupational goals within the scope of these factors.
Moving forward with occupational therapy services, Michaela and Kevin continue into the first action point of the CPPF. This is called Enter or Initiate. During their interaction, at this point, Michaela will identify the client and other stakeholders.
So hi Kevin, my name is Michaela and I'm an occupational therapist. My role is really just to collaborate with you to establish some goals and try to identify and knock down the barriers that are preventing you from reaching those goals right now. Today will consist of just discussing kind of what you want to get back to doing once you leave this facility and me asking you a lot of questions. So you don't have to answer all of the questions. Basically just the more information you give me, the more information I have and the better I can understand your story. I'm here to work with you and I really want you to know that I want your point of view. So everything that we discuss will be confidential, but I do need to disclose that if you say something that may put yourself or others in harm's way, I do have to report it just for the well-being of yourself and or others. Do I have your consent to move forward with today's session?
Yes, you do have my consent.
Excellent. And just so you're aware, you can revoke your consent at any time, whether it be in the middle of a session or after multiple sessions. Okay?
Okay.
Excellent. So you can refer to me as Michaela. I know your name's Kevin, but would you prefer I call you something else?
Yeah, you can call me Kev.
Kev?
That's what you
All right.
want.
All right, that's great. So let's get started. I'd love it if you could just tell me a little bit about your family. Like, do you have a spouse, children?
Yeah, I have a wife and 2 older sons.
Okay, great. So do you want me to have permission to speak with your wife or children, or would you like your wife here at our sessions, or would you kind of just prefer this would remain between you and I?
Honestly, I'd prefer if it just stayed between you and I. I don't want to put added stress on my wife or kids.
Okay, understandable, of course.
So at this Enter/Initiate action point, Michaela explained why she is there today and obtained informed consent from Kevin before continuing on with her practice. At this point, Michaela and Kevin have begun their therapeutic relationship. This partnership is grounded in the active participation from both the client and therapist. And this meeting paves the way for all future interactions between Michaela and Kevin.
At this point in the meeting, Michaela and Kevin will now enter action point 2 of the CPPF, set the stage. Here, they discuss Kevin's occupational history to better understand his occupational goals, as well as the expectations both Kevin and Michaela may have. Identifying occupational performance issues, or OPIs, is key here. Michaela will also have to now think of other stakeholders that may be useful to bring into Kevin's plan.
So Kevin, before we dig a bit deeper into your story, I'd like us to just kind of set some ground rules. What I expect from you is that you'll come into these sessions with an open mind and try and be as honest as possible with me so that I can help you. I want you to know that this is a safe space and it's my duty to maintain it as one. As far as communication goes, you can contact me via phone calls, texts, emails, but I do only check my texts and emails from 7 a.m. to 7 p.m. If there's something you need outside of those hours, you can call me. Does this sound reasonable to you?
Yeah, that all sounds good.
Yeah, okay. So let's get started then. I'm just gonna ask you, if there is a main goal you have right now, right here, what would it be?
I honestly just want to get to work, back to work as soon as possible.
Okay.
I know my unit must be missing me and waiting for me to get better. And I think my biggest issue right now is how I've used substances to kind of cope with my problems. And after being clean for the past 3 months, it's only become more obvious how much this affects me since my PTSD symptoms have gotten a lot worse since then. So yeah.
Okay, That's a great start. It really seems like you've done a bit of digging and in yourself as to what's going on here. So for right now, would you kind of agree that your main occupational goals are to identify some new coping mechanisms to try and manage those PTSD symptoms that are kind of the barrier for you getting back to your workplace?
Oh yeah, for sure.
Yeah? Okay, excellent. So,
The OT will need to select a frame of reference to help guide their practice.
Hi, I'm Frame of Reference. Within the CPPF, I explain the perspective that is used to approach a case. Various frames of reference exist to ensure a specific understanding of the occupational issues and goals for each individual client. Because Kevin's occupational issues are largely cognitive and affective, the frame of reference that will be used is the cognitive behavioral frame of reference. This perspective allows the clinician to understand the occupational challenges in respect to cognitive deficits that are characterized within the PTSD and other mental health issues. Utilization of this frame of reference will be able to guide assessments and treatments within a foundational understanding of cognitive impairments and subsequent behaviors that follow.
During the interaction, Michaela should always employ an equity lens for occupational therapy to help her be aware of the inequalities that happen within the environment that may contribute to Kevin's situation.
So hi, I'm the ELA. The cognitive behavioral frame of reference is utilized because it closely relates to the social determinants of health that are creating the inequities for Kevin, specifically childhood experiences, coping skills, and culture. So for the equity lens number 1, the equity issue, Kevin's ability to receive care is limited by both access and utilization. The former is because of the fact that Kevin currently does not have a counselor or psychologist in his hometown. Cost is likely to be another barrier for care should a counselor or psychologist become readily available. This is because he has expressed worry about the financial strain placed on his family due to a decrease in pay and benefits if he does not return to work before August 23rd. In the province of Ontario, counselors and psychologists are not covered through OHIP. This creates an inequity as individuals with mental health conditions may have difficulty maintaining full-time employment, resulting in a decrease in income and health benefits and subsequently a lack of mental health treatment. Because this inequity stems from the government's policy of not covering the services through the public health system, it is a macro-level inequity. As the occupational therapist, I would hope to advocate for macro-level policy changes so accessing these services as soon as possible would be easy and would be financially accessible. This way, he would not need to stress about returning to work on a tight deadline and can therefore reaching a place where he can comfortably return to work on his own pace and thereby reduce the stress on him. Some resources that are free of charge include the CMHA support line, which provides 24/7 assistance to individuals struggling with mental health conditions and can provide Kevin with consistent support. More precisely, the Badge of Life and Boots on the Ground are two peer-led organizations that support police officers dealing with mental health conditions due to their employment. So for equity lens number 2, within the societal context, the cultural environment seems to be an issue of concern, creating a barrier for Kevin's return to work. Culture in this context is referring to COP culture, in which self-reliance and strength are prioritized and weakness in the form of going to therapy or being more emotionally open are frowned upon. Essentially, they're stigmatizing mental health and making it more difficult for those who need help to get it. These are barriers that are difficult to change quickly. We are assuming that Kevin's workforce is quite hypermasculine, causing him to feel shame to return to work after being in a mental health facility. We presume that Kevin fears that his experience with mental health makes him less masculine and ultimately does not align with the profession's culture. One meso-level approach to address this inequity that Kevin is experiencing is to advocate for workplace mental health training. We discovered that the Canadian Mental Health Association, or CMHA, provides evidence-based workplace training that is interactive and solution-focused to help create safe, psychologically healthy workplaces. Kevin stated that his supervisor at work is aware of his situation and is quite supportive. Therefore, as Kevin's occupational therapist, we view his supervisor as a vital stakeholder to discuss with and advocate for the possibility of enforcing workplace mental health training within the division.
The next step is for Michaela to more deeply evaluate the personal, environmental, and occupational aspects of Kevin's life. Michaela will now use various assessment measures to further identify plausible explanations of each of Kevin's OPIs.
now Kevin, if you agree, I would like to conduct a few assessments with you to try and dig a bit deeper into your symptoms and your current coping mechanisms. So during these assessments, we'll try to decide, or the results of these assessments will help us decide upon appropriate action to take and create a plan and objectives for the future moving forward. So you can choose to withdraw from any of the assessments at any time. Do you have any questions before we go ahead?
No, that all sounds good with me.
Okay, cool. So there is going to be 3 assessments. It sounds daunting, but they're all pretty quick. So the first assessment is called the Post-Traumatic Diagnostic Scale. It's a self-reported survey, so I won't be asking you the questions. I'm just going to hand you a piece of paper and you're going to answer them to the best of your ability. This assessment uses a numeric scale of 0 to 4 to rate or describe how often a symptom or problem has occurred over the last month. So 0 being never and 4 being 6 times or a week or more. The assessment will only take you about 10 to 15 minutes to complete. You can always take a break after. Does this all sound okay?
Yep, sounds good.
All right, so here is the first assessment. So go ahead and take your time, and I'm here if you have any questions.
All right.
The PDS is currently being used in the DSM-5 to determine the severity of PTSD symptoms. The knowledge can then be used to move forward with Kevin's treatment and find suitable solutions.
All right, feeling okay?
Mm-hmm.
Yeah? All right, so the second assessment we're going to do today is called the Coping Inventory for Stressful Situations. So the point of this assessment is to determine your current coping strategies and how well they're working for you. This will help you and I determine what new coping mechanisms we can implement and or try to use in the future. This is also a self-reported survey, so again, just a paper, you're answering the questions. It's a bit longer, it's 48 questions, but again, it's pretty quick, so it should only take you 10 to 15 minutes.
All right.
Currently, the CISS is being used in PTSD and police research as a tool to understand what type of coping strategies are being used and how to increase healthy coping coping skills and behaviors.
Oh, that was quick. All right, you still feeling okay, Kev?
Yep.
Good. All right, so the third and final assessment is called the Beck Depression Inventory. This is also, again, a survey, so you're going to be answering the questions on your depression symptoms over the past 2 weeks. It's just 21 questions long, but please do take your time. And the purpose of this is to try and help us look into the lack of motivation that you've been experiencing lately.
Okay.
Okay.
The Beck Depression Inventory is currently being used in PTSD research with police. By understanding the current depression symptomology, such as Kevin's amotivation, he can then move on to further higher level tasks and cognitive functions that will be necessary in his management position.
So far, Michaela and Kevin have gone through 3 of the 8 action points. We will now bring your attention to the in-person portion of our presentation, where we will move into the next action point.